Now, the combination of cytokines and inflammatory insults and possible organ hypoperfusion, reduced blood supply to the organ, can reduce the efficiency of the lungs, the liver, the kidneys, and also the brain. It can affect the brain. With its cerebrum, brainstem, and cerebellum. So there can be effects of cytokines on the brain. And collectively, these cause what we call AMS, altered mental status. So AMS as a feature of sepsis. Now, there's some fairly obvious effects that we might notice. Some people become sleepy. We call that somnolence. And that's good because it means that the body rests and can recover from the infection and from the inflammatory effects of the infection. And of course, malaise. I remember a lovely old doctor that gave me my introductory medical lectures a long, long time ago. And when he was describing the clinical features of almost every condition, he talked about general malaise. The patient just doesn't feel well. You have malaise, you don't feel good. And usually this is associated with anorexia. The patient doesn't feel like eating. So anorexia means a reduction in appetite. Now, anorexia nervosa, actually, it's a misnomer. These patients are not anorexic. They don't have a low appetite. They can have a quite profound appetite. They just don't eat for various psychological reasons. And there can be more severe effects as well. Some patients can develop a delirium. Delirium. They can become delirious. This is like an acute confusional state. So delirium is like an acute confusional state, and there can be disorientation for time, place, person. And especially in older people, they can become really very difficult to manage because they're delirious. They don't know where they are. They're just acting in a completely chaotic way because their brain's not functioning. Because older people don't have the redundancy, they don't have the spare capacity, and are very prone to delirium with infection. Having said that, younger people can get delirium as well, of course. I remember as a child having a fever, getting quite bad hallucinations. Hallucination is a percept or perception without an external stimulus. And I remember having a fever and visual hallucinations, and the effect on my young brain. Less likely to occur in adults, but certainly occurs in children. And in severe cases, sepsis can actually induce encephalopathy. Very often caused by inflammatory insults and hypoperfusion, as well as the cytokines, but there can be an encephalopathy. But the common ones we see are the sleepiness, the tiredness, the not wanting to do anything, the wanting to lie down, and the very feeling of sickness when you feel ill. That is the effect of the cytokines on the brain, the anorexia, possible delirium, hallucinations, encephalopathy. So the altered mental status really is the total brain presentation of feeling ill. And when you're not ill, haven't been ill for a while, you forget just how awful it is. This malaise, this feeling of illness can be absolutely terrible. I remember when I had influenza once, I was trying to get into bed and I couldn't make it. I was lying on the floor. Felt utterly so ill. It was unbelievable. And I remember thinking, yeah, I don't care if I live or die here. I just feel so ill. I no longer care because of the effect of the cytokines, causing this extreme malaise, this feeling of sickness because of the effect on the brain and the way that the brain generates the mind. So be empathetic, be kind, be generous to our patients with sepsis because they're going through a really awful, awful time. They do not feel well at all.